All right. Well, I think it's safe to say we can get started. Thank you all for being here. This is our program called Breathing Better with COPD, the importance of primary care. My name is Molly Lynch. I'm the Chief Communications Officer at Village, and I'm also your moderator this afternoon. Before we dig into our program, I just want to touch on one quick housekeeping item. At the bottom banner of your Zoom screen, you'll see a Q&A feature. Please feel free to use it. We do want to learn more about you. So please feel free to send in those questions. It helps us in the future as well. It helps us learn what you want to learn about, and we're happy to hear more. So now I'd like to share a little bit more about us, about Village Medical, as well as our partnership with the COPD Foundation. Village Medical is a national primary care provider. Our number one goal is helping our patients get well and stay well. We have a team of doctors and advanced practice providers who spend more time and more attention with our patients to help coordinate their care. We truly believe that healthcare should be personal, accessible, and coordinated. I'm also very proud to say that we have a partnership with the COPD Foundation. Their mission is to help find millions of people living with COPD to help them live healthier and better lives through their research and their advocacy. I'm thrilled that they're here. I'm joined here today by Dr. David Hatfield, Chief Physician Executive of Village Medical, as well as Dr. David Menino, the co-founder and Chief Medical Officer of the COPD Foundation. Thank you both for being here.
Molly, thank you for having us. So proud to be part of this call today and to join it with Dr. Menino. I am a longtime family doc, and so COPD is something that's near and dear to my heart. So happy to be part of this call today.
Wonderful.
And
thank you.
and thank you, Molly. I am also thrilled to be here, and the COPD Foundation, and we're celebrating our 20th anniversary this year. And our goal is to make lives better for our patients with COPD and to work towards, ultimately, finding a cure for at least, some of our patients with this terrible disease.
That's wonderful. Thank you. I would love for both of you to tell us a little bit more about our partnership.
Yeah, we in primary care, we understand that for our patients to stay well and stay on that care plan that you talked about, Molly, like we know we need partners in the community and partners in the nation. And we are so proud to be part of the COPD Foundation, to lean on them for the latest news on COPD, but also some of the information that we disperse to our patients. Like we want to be able to find good partners in the community. So just grateful to be a part of this community of finding those patients that are potentially suffering from COPD and don't know it, and that we need to diagnose. And then how do we manage those folks with COPD, get the right information in their hands and treat them even better.
Yeah, and as Dr. Hatfield mentioned, to find those patients, it's going to have to be in primary care. And that's why it's incredibly important to us at the COPD Foundation to work with various partners, including Village Medical, who take care of patients as primary care providers.
Yeah, David, you mentioned Dr. Menino. You mentioned it's so, primary care at the heart of it is early detection and prevention, right? And so that's so integral in the treatment and management of COPD, is to find it early so that we can get the right treatments and prevent the disease process from progressing.
Absolutely. Couldn't agree more.
Wonderful. Thank you both. Well, let's shift over to a poll. Let's learn a little bit more about our audience here today. So this poll asks us where you're at in your COPD journey. So please do share where you're at. If you're newly diagnosed, if you've been living with COPD for less than 5 years, perhaps a long time that you've been managing COPD, or if you're a caregiver tuning in for more tips, or perhaps a healthcare provider. Wonderful. And we're starting to see some results come through. pretty split between people living with less than 5 years or perhaps a long time, and some who are newly diagnosed as well.
You know, Molly, it always stands out to me when I see I am newly diagnosed with COPD, chronic obstructive pulmonary disease. I can only imagine how that 16% feels, right? Like a little bit scary. Maybe there's no hope. Maybe they don't know what to expect. They don't know if there's how long can I live with this? Is it curable? I mean, a lot of questions probably that group is faced with, because they've been told that they have this diagnosis that's not curable, and now they need answers, right? So
Right.
hope today they glean something from this that maybe will help them in their journey, and as they start to solidify that relationship with a primary care physician and or potentially a specialist. Dr. Menino, what kind of stands out to you there? Is that?
Well, yeah, and you mentioned that, but also, and the third response there is I have lived with COPD for a long time, which to me says more than 5 years, since another answer is less than 5 years. And this highlights the reality that COPD is a chronic disease, but as is true with other chronic diseases such as diabetes and heart disease, it can be managed. And you know, on our the COPD Foundation has a social site that answers questions that people have with COPD. And as you mentioned, one of the major questions is for people who've been newly diagnosed. You know, they consult Dr. Google, who tells them that that they're going to not live very long. And the reality is that most patients with COPD actually can live long and fulfilling lives, but it just is a disease that has to be managed. And I think, and I'm pleased to see that more than 1/3 of our responders are people who've had with COPD for a long time, which means that they're living with it and managing it well.
It's wonderful. Thank you for sharing that, Dr. Menino. So now I'm going to turn it over to a discussion between Dr. Hatfield, Dr. Menino, and 2 patients with COPD who are joining us. So now it's over to Caroline Gaynor and Dr. Hatfield.
Without further ado, I'd like to introduce one of our special guests today. Caroline Gaynor happens to be a COPD patient, and she's going to share with us her story and kind of just start at the beginning. Caroline, we're so happy to have you today.
Great, thank you. Well, I had been wondering about my breathing for probably 3 or 4 years before I actually was diagnosed. And the way I was diagnosed is that one morning I came upstairs from my family room, and as I got about halfway up the stairs, my feet felt like they were too heavy. I couldn't pick them up. My legs were they felt like they had cement in my shoes. And by the time I got up to the top step, I actually fell into the hallway, gasping for my breath. And by the time I got to the phone, I was in a brain fog. I couldn't remember what that number was I was to call to get me help. And finally, I got myself calmed down and remembered it was 911. And I called an ambulance, took me to the emergency room. And in the emergency room, they told me that I had a collapsed lung. So that was why I wasn't breathing too well. And after that, I was in the hospital that time for 14 days, 12 of them in ICU, and 2 more days just to make sure that I was strong enough to go home. I had 2 more pneumothoraxes after that. And then, of course, in the meantime, right after that, I went to see a pulmonologist, and I was given an inhaler, and I was taught how to use the inhaler, which not everybody gets that luxury, but I was. And I did pretty well, I thought. And then I had another pneumothorax, And at that point, I was told that I needed to gain some weight because I only weighed like 94 pounds. I was still working, and my doctor said, I think we need to get away from sick people. You don't need to be breathing in bad air. You need to retire. And that would be my second retirement because I'd already retired from teaching school for 38 years, and I retired as jewelry coordinator from Sears then after another 10 years. Other than the pneumothoraxes, I have had a very bad case of pneumonia summer before last that was actually classified as ARDS. So I don't do little things, I just do big bad things.
Caroline,
I do pretty well.
Caroline, prior to that episode of going up the stairs, had you really noticed much? Had you noticed some shortness of breath, or tightness, or wheezing, or excessive coughing, or had you been trying to quit smoking, and so you thought you were on your way to better breathing, or where were you at, kind of at that moment in time?
I actually had had looked at whether or not I might have COPD, but then I thought, nah, I don't have that. I can still run, and which I still could at that point. I could still run. I didn't have any trouble coming up and downstairs. And I had been short of breath before, and one time it was my heart, and one time it was my thyroid. So I was well aware of that if you were short of breath, something was wrong. But no, I wasn't particularly short of breath.
Caroline, I can see that you're wearing oxygen. How long have you been using oxygen now?
I've been using oxygen since 2016.
You know, one of the things that we say is that everybody needs oxygen. Some of us just need a little bit more, and particularly you know, people with COPD are in that category. How have you dealt with people who ask you questions, particularly like children, about you know why you have these oxygen on your face?
Well, I usually have my what I call my jet pack on. So I tell them, well, you know, I'm from outer space. I have a jet pack. Sometimes I do. Depends on the child and what the situation is. But then I explain to them that I said, well, you know, you don't need any help to breathe, but I need help to breathe, and this helps me to breathe. And that's what I usually tell them.
You know, Dr. Menino, it's interesting to me that kind of Caroline went from 0 to 100 real quick, like with her symptoms, and then some real serious complications. By the way, Caroline, we are glad you are with us because those are serious complications from COPD, right? And it's most people, you know, it kind of creeps up a little bit more slowly, right? Like they notice a little shortness of breath, a little coughing, a little wheezing. It's kind of behind the scenes, and people don't recognize it as like chronic obstructive pulmonary disease or COPD, and they either might buy an over-the-counter inhaler or a cough medicine or something to try to mask it. But we, you know, at Village Medical, we're a primary care army, and we're banking on the fact that people will come early to a primary care physician, and when they have those symptoms, they'll bring it to the attention of a primary care provider so that they can do all the tests, whether it's a chest x-ray or whether it's, you know, we use spirometry, which is basically a test of the lung function to help diagnose early COPD and to help people get on the right medicines, the right rehabilitation, and just all the little things that we need to do to help manage their COPD. But Dr. Menino, what is your experience there?
Yeah, and I think that's Caroline's story is not a terribly unusual one. And I often, when I explain this to patients, I will say it's sort of like, you know, inching towards the edge of a cliff. that you don't realize you're going downhill, and then all of a sudden something happens that pushes you over. And I suspect that Caroline's lung function, that she had symptoms that were sort of you're gradually increasing, but it was that major event. And sometimes it's a collapsed lung, sometimes it's an episode of pneumonia, sometimes it's a severe type of exacerbation, that suddenly really gets their attention. And part of what we do and why we are partnering at the foundation with primary care providers like Village Medical is to identify these people earlier in the process when there's more potential to help them.
Yeah, that's fantastic. We really focus on chronic disease conditions at Village Medical, and certainly COPD is one of those chronic disease conditions that we just believe we can make people's lives better by intervening early, giving people rescue packs, so rescue treatments, so that when they do find themselves in those tight spots or moments when they feel like, wow, this COPD is different than my last event. Like, I better get on something early, even before I can get to the doctor or see my primary care physician. At Village Medical, we have support that we offer, and if people would want to go to our website, villagemedical.com/COPD, they can find out a lot of information. They can understand the early symptoms of it, the things that we do to diagnose it. How do you treat mild COPD versus moderate COPD versus more severe COPD?
Yeah.
Go ahead.
My primary care physician had given me, the in-office barometer, not the full thing, but and he had said, Caroline, I want you to quit smoking before something really bad happens to you.
Yeah.
And something really bad happened to me.
Well, Caroline, we're grateful that you are on a COPD action plan and that you are being well cared for by a primary care provider. And I would imagine you probably have a pulmonologist that's helping you as well.
Yes.
But so grateful that you were able to join us. I want to get to our next guest. Barry is with us today, and Barry, we would love for you to share your story and your journey with COPD. And I know it's a little different than Caroline, so we probably will uncover some different things as we talk with you. But thanks for joining us, Barry.
That's quite all right. I had asthma all my life, and stupid me picked up smoking when I was in college. Didn't help matters any, but I went fumbling through life, and I just had shortness of breath from asthma once in a while, and I didn't think much of it, and I'd have the inhalers and it'd clear it up, or I'd have to go get a shot. But in 2015, my primary care physician, who cared for me since 2004, finally sent me to a pulmonologist, because she realized what I didn't realize, I had COPD, but she saw something in it. And I went to the pulmonologist, and he did all the tests, and he came back, told me I had stage 3 COPD. When I was done with that appointment, I went out to my car, picked up my cigarettes and my lighter and threw them away. Never had the desire again to smoke. It literally put the fear of God in me. That, it was the shortness of breath that I had noticed the most.
And Barry, do I understand correctly that you were at pretty near 2 packs a day?
Yes, if not more. Them and cigars. And I threw the cigarettes out, and my pulmonologist said, "Don't even think about picking up a vape. We don't know what's in that." I had no desire to. I wanted to breathe.
Yes, and Barry, and your story raises a couple of interesting points. First, and people who have a history of asthma as a child are much more likely to develop COPD, whether they smoke or not. And we now know that up to 25%, 1 in 4 of adults in the U.S. and other countries who have evidence of COPD have never smoked. And among that group of history of asthma is one of the biggest risk factors. Of course, you combine asthma with smoking, and it dramatically increases that risk of developing COPD. And I have to say that you are one of the fortunate ones in that cigarettes are incredibly addicting. And, and most people have, and I've had many patients over the years who have tried multiple times using multiple different things to stop smoking and have not been successful. But certainly, one of the things that seems to be a predictor of success is a life-altering diagnosis, such as COPD or other sort of diagnoses that really serve as a wake-up call for people to change and to deal with this addiction.
Dr. Menino, it's interesting. I kind of was pre-reading a couple things, and I noticed that Barry and Caroline have something in common in that both of them, despite Barry's smoking habits and despite the shortness of breath that Caroline, both of them felt like, oh, well, COPD, that won't happen to me. Like that's those people over there. Like, right? That person will get it. And it's interesting that's kind of how we do with our healthcare, right? Like we view the lens a little differently when we're looking at ourselves. We don't see it like that could ever be us. Barry, am I hitting the nail on the head there, Barry?
Yes, you are. That's for somebody else, I thought. Hey, that's somebody else.
Yeah, as a primary care provider, I have to give a plug for early detection, early diagnosis of COPD, all of the different things that we do when a person has COPD to help prevent sickness, illness, hospitalization, exacerbations. I think of vaccination. Heaven knows we're not that far from a global pandemic that I can't imagine. I don't even have the number of folks that had COPD going into that global pandemic, but without a vaccine or an awareness of even a mask or just isolation, right? Like that we didn't even know early on how many people either suffered severe illness or loss of life. So this is a plug for folks with COPD to please see your primary care provider and get the all-important vaccines that they recommend, which could mean everything from pneumonia vaccine to flu vaccine and certainly COVID-19, right? Dr. Menino, would you add anything to that?
Yeah, absolutely, Dr. Hatfield. That when on the COPD Foundation website that has opportunities for patients, particularly those that are newly diagnosed, to interact with other patients and people like me, when they ask, well, what can I do? And there are things that people can do. If they have exposures such as cigarette smoking or occupational exposures, to stop those exposures, to start an exercise program, to pay attention to their diet, to avoid respiratory infections, and sometimes that would include not having your sick grandkids around you. And then of course, as you mentioned, vaccinations. And not only there's influenza, there's flu, there's now the pneumonia vaccines. There's the newly available RSV. Respiratory syncytial virus. There's the shingles vaccine, and these are all critically important in the management of our COPD patients.
And Dr. Menino, it's important to note that while today there is no cure for COPD, we can certainly manage it, improve patients' lives, and even reverse it to some degree. That's correct, right?
Absolutely. And in fact, if you look at the 4 pillars of the COPD Foundation, number 1 is finding a cure. Number 2 is to optimize the lives of our patients with COPD. Number 3 is to promote the movement of people with COPD who have long been silenced for various reasons. And then finally is really develop more research funding so that we can find a cure and do all these other things.
Well, as you know, we are grateful for our partnership with the COPD Foundation and you, Dr. Menino, and look forward to continued partnership efforts in this space. Just want to remind everybody to go to villagemedical.com/COPD to learn more, and you will see the COPD Foundation logo all over our material because we believe so strongly in this partnership. Thank you, everybody.
And thank you, Dr. Hatfield, and Caroline and Barry. Thank you for sharing your stories.
Wonderful. Thank you. What a great discussion. I'm so grateful that Caroline and Barry were there to join us. So, Dr. Hatfield, can you tell us a little bit more about these educational materials and where we can find them?
Yeah, as we said there on the video there, that we're super excited that we partnered with the COPD Foundation, villagemedical.com/COPD. And you'll find, we see a lot of the questions coming in the live Q&A around some of those answers are right there. Understanding COPD. If you go there, you can download a free educational packet.
Yeah, wonderful, wonderful. And Dr. Menino, I have to say, what a powerful statement you made when you said everyone needs oxygen. Some of us just need a little more. That was really powerful and really wonderful. Thank you. So let's turn it over now to another poll. We have time for another poll. A little bit of a pulse check on how people are feeling right now. So are they hopeful? Are you feeling informed? Are you feeling concerned? Okay. Wonderful. Okay, a lot of hopeful, want to learn more. That's good. That's good. We're here to help with that, right?
Yeah, I think all of those are responses that I would have expected, like everything from worried to hopeful, and that's the key. I think to have a good primary care partner and to help navigate what you're feeling, to help answer those questions. Saw a lot of live questions coming in on the chat that I hope we're going to be able to get to some of those. But I heard something interesting said about hope. You have to have hope, and they say hope is not a strategy, but I think hope is the beginning of being able to see the light at the end of the tunnel, right? Because you need rain and sun to be able to have something grow. Well, you need hope and strategy. So it's not just the strategy around how we're going to manage COPD, but people need to feel hopeful. And I think with the right information, the right education, people can feel that hope around COPD. Wouldn't you agree, Dr. Menino?
Absolutely. I would say, yes, I'd rather have somebody be hopeful than feel helpless. So, and I think there's many things to be hopeful about, because over the past 10 to 15 years, we've made great progress in both our understanding of COPD and understanding how it progresses and how we better classify and treat it. And I think over the next 5 to 10 years, we're going to see dramatic changes in how we approach COPD.
Wonderful, wonderful. Well, in the spirit of learning more and sharing more, how about we do some of the questions and answers? We've received quite a few in the chat, and we've also received a lot leading up to this as well. Dr. Hatfield and Dr. Menino, two of the questions that we had were, what are the major causes of COPD? And can you get COPD if you're not a smoker? If you're not a smoker.
Yeah, this is a great question. Many times people just believe that COPD is a smoker's disease. And certainly smoking is the #1 contributor to COPD, but it's not the only contributor. right, Dr. Menino? We know that air pollution and chemicals can also induce COPD, correct?
Absolutely. And although, yes, in high income countries like the US, cigarette smoking is the leading risk factor. But you go into other parts of the world, and that's not the case. We have exposure to biomass fuels, people that burn wood and coal and other agents to heat their homes and to cook with. And as I mentioned earlier, asthma is a big risk factor. Prematurity, early life respiratory infections. There's always a genetic component that all of these things factor into who may develop COPD. And it's also a disease of aging, things that sort of accelerate aging, or other sorts of what we call comorbid diseases, other diseases that may exist in an individual may increase the risk of developing COPD. And as I had mentioned, 1 in 4 people with evidence of COPD in the US have never smoked. And that's and COPD develops in people long after they've stopped smoking. So all these factors are important. So it goes well beyond just cigarette smoking.
Wow, that's significant. Another one that we've heard quite a bit from are there exercises to help with your breathing or to prevent any flare-ups as well?
Yeah, I would say yes. Exercise is always good, and any exercise is better than no exercise. The best exercise in general are aerobic exercises, walking, swimming if you like to swim. And these are things that that both get your muscles moving, but also as part of that process, it encourages deep breathing, which is always good.
Dr. Menino, are there certain exercises that a COPD patient should avoid, or certain conditions that they should avoid exercising in?
Well, yeah, this is a question that comes up on our social channel, and certainly, for example, patients with COPD are more likely to have blebs in their lungs, which are little sort of air sacs that, and as you heard in Caroline's story, that she presented with what was called pneumothorax, which was basically a breaking of one of these blebs. So we advise against activities where there is a sudden drop or change in air pressure, things like skydiving, or actually sort of you diving underwater to depths, scuba diving and the like. Because these, if a person does in fact have underlying lung disease or blebs in their lungs, and that increases the risk of these things rupturing. Flying in airplanes, which are pressurized to 8,000 feet, in general has not been a problem, although I advise patients that they have multiple recurrent pneumothoraces, and we may need to sort of you rethink that in that period, when they're sort of recovering from that pneumothorax, whether they should be flying or not.
What about humidity and cold temps, like really cold? Not like like below freezing temps. Like, should people avoid the
Like
humidity?
Chicago temps, you mean?
Like Chicago, not Arizona, Chicago temps.
Not Phoenix, Chicago.
Yeah. Again, one of the things that we find out is that every COPD patient is different, that some prefer cold weather, some prefer warmer weather, and conversely, and some people can't stand it when it's humid. Others prefer humid. In general, patients tend to prefer less humidity and somewhat warmer environments. But again, everybody's different. And I always tell my patients, whatever works best for you, whatever feels most comfortable on you, because one of the other sort of questions that has emerged, and we may address that as like, well, do I have COPD? Do I have asthma? Do I have allergies? And well, some people have all three. It doesn't And for example, some people with more of an allergic component may have more problems in certain indoor environments because of mold and other sorts of indoor allergens, whereas people that don't have that yet still have COPD may do better in that type of environment. So it goes to, I think, highlight the point that every patient is unique and different, and ultimately, people have to sort of figure out what works best for them.
That's really interesting because we did receive some questions that said, how can I be sure it's COPD or asthma or allergies, which you really spoke to. So I'm going to shift into another question, kind of a two-part one for you both. Can COPD be cured or halted? Does it continue to get worse?
So I'll take the first one. There currently, and Dr. Menino alluded to this in the earlier conversation, that there is no cure for COPD today. We are hopeful. We continue to do research, and there's money put into that to find a cure for COPD, but today there is no cure for COPD, but it doesn't mean that it cannot be managed effectively, and people can live long lives with COPD when it's managed.
Yes, and to build on that concept, COPD is a chronic disease, just like diabetes, high blood pressure, and as other chronic diseases, they can be managed, very rarely cured. Lung function declines as we get older. Basically, all of us through childhood, adolescence, and young adulthood, our lung function increases, and it sort of peaks, reaches its peak somewhere between 20 and 25. And then after that, it's downhill. Your lung function continues to decline with age. However, while that is true, how we classify and treat COPD and gauge COPD severity is related not only to a person's level of lung function that historically has gotten more focused, but now we focus on the symptoms that people have, their exacerbations, and their capacity for exercise and other things, and using those other metrics that some people with COPD do in fact get better. If you can take a person from having more symptoms to fewer symptoms, or from having lots of exacerbations or flare-ups to fewer ones, you have in fact improved their COPD and their and have improved their lifestyle and their expectations of what they can do. So I would say yes, and we can improve COPD. We may not be dramatically improving the absolute number of lung function, but can improve quality of life and other metrics that are in fact very important to patients.
Dr. Menino, when I was visiting with my patients, I would say to them, they would say, hey, am I doing everything to help my COPD? You've got you on this medicine, we're doing this, I'm trying to lose weight to improve, my breathing, my diaphragm function. And I know this seems like it's the elephant in the room, but I would always remind them that if you're still smoking, the number one thing you can do to halt COPD is to stop smoking. Like, that seems obvious, but many of my patients continue to smoke even while we were treating and managing their COPD. But it didn't stop me from beating that drum of we've got to figure out a way to stop this brutal addiction.
Yeah, absolutely. And as I mentioned earlier, cigarettes are incredibly addictive. They're actually designed to be that way. It doesn't happen by accident. And overcoming with that addiction is challenging. Barry's story was, one that I've heard several times, but it's not a typical one. And typically, in the average person who is addicted to cigarettes has more than 5 or 6 quit attempts before they are finally successful. So we encourage them to keep trying. And we now have other sorts of therapies. We have nicotine replacement, we have varenicline, we have bupropion, and other types of therapies that may be helpful in helping patients quit. And I tell them, hey, whatever works. It's like, how about hypnosis or acupuncture? And I advise them to use whatever they can to help them stop this addiction in them. That being said, yeah, even our patients that continue to smoke, we treat them, and we treat our hypertensive patients who continue to have a high salt diet. We can continue to treat our diabetic patients who may not necessarily strictly follow their diabetic diet. That's just something that I think we as clinicians are obligated to do, understanding that they are dealing with an addiction.
Great. Thank you. Thank you. I think we have time for one more question, and this one I'm going to take from the chat. Dr. Hatfield, I have a feeling you'll have some opinions on this one or some advice. Do you recommend anyone diagnosed with COPD to secure appointments with a pulmonologist, or should you have your PCP work with them?
So I'm so glad, Molly, I'm so glad you picked that one. I actually wrote it down and was hoping we would get to it.
Oh, good.
And so many of these questions kind of are primary care PCP focused. So many of these questions should start there. Like people said, hey, how do I diagnose COPD? Is it my pulmonologist? Is it my PCP? Do your primary care physicians have access to pulmonary function testing or spirometry, as we mentioned earlier? If you have a question or you have what you believe to be an early sign or symptom of COPD, or if you're a longtime smoker and you're not really feeling any symptoms, but you want to be evaluated with either a chest x-ray or pulmonary function test or spirometry, yes, please see your primary care physician or primary care provider, and let's start the process of diagnosing you so that we diagnose early and intervene early.
Awesome. Thank you. Thank you. Thank you. All right. So I think we will go on to do one more last final poll, shall we? So how do you like to learn more about COPD and managing this condition? So please tell us, how do you want to hear more? How do you want to have more educational materials? We're all ears here. We're always looking for new creative solutions, and we want to be a resource for you. And I think the cool part about this one is that you're allowed to answer more than one answer, I believe. So.
Molly, while you're doing that, I will just say there's a lot of questions in the chat, and I know that there's a lot of questions about treatment, which drugs are available. My recommendation would be don't go to Mr. Google, don't go to your pharmacy and pick up a cough medicine or a Primatene Mist. Talk with your primary care provider about the best treatment and kind of the gold standard treatment for where your COPD is, whether it's early diagnosed and mild or more moderate or in that severe stage.
Yeah, that's wonderful. Great advice. Great advice. Thank you. Okay, well, so I think we can move on here. I want to say thank you all for joining us today. There is a quick survey at the very end. We want to hear what you have to say. Your opinion matters to us. I also want to give a special thank you to both Caroline and Barry for joining us. We're so grateful for their insights. We're grateful for them sharing their experiences and their journey. And last but certainly not least, Dr. Hatfield, Dr. Menino, thank you so much. Thank you, thank you, thank you. So appreciate you sharing your wisdom.